What's up, guys? How's everyone doing out there today? My name is Jack, and this is Rate Your Pain 1 to 10. Before we get started on today's episode, I just want to give a little shout out and a happy birthday to my late father, who'd be 68 today on June 19th. Here's a fun little picture to show you guys of us camping back probably in 1986, 1987. If you look just to the right of my dad's waistline area, you could see me sitting down in a little chair eating a sandwich. Picture quality is not too great because this is an old photo, but if you look closely enough, you could see I actually had the old school looking bowl cut. My mom literally used a bowl on my head to cut my hair. Alright, well, happy birthday, Pops. This episode is part 2 of 3 in a series where we're talking about my personal story and disability. Today we're going to be discussing RSD, or CRPS. RSD stands for Reflex Sympathetic Dystrophy, and CRPS stands for Complex Regional Pain Syndrome. They're both the same disease by definition, however, CRPS is the more modern terminology for it today. I'm going to read you guys the definition of CRPS by the NIH and the National Institute of Neurological Disorders and Stroke. They say complex regional pain syndrome is a chronic, and by the way, chronic means lasting more than 6 months for those who don't know that. It is a chronic pain condition that most often affects one limb, arm, leg, hand, or foot, usually after an injury. CRPS is believed to be caused by damage to or malfunction of the peripheral and central nervous systems. The central nervous system is composed of the brain and spinal cord. The peripheral nervous system involves nerve signaling from the brain and spinal cord to the rest of the body. CRPS is characterized by prolonged or excessive pain and changes in skin color, temperature, and or swelling in the affected area. So there's a lot more on their website you guys can look at if you're interested to learn more about RSD other than this episode and want to see what they have to say about it. I'll include the link in the description below here. But as you can see, it's basically the nerves just going haywire. It's the sympathetic nervous system specifically. So you've heard of fight or flight mode, right? Well, that's your sympathetic nervous system. Your body is constantly sending signals saying that you're in pain. Because of that, it's not like it's phantom pain. It's actual real pain your body is creating. And you can see physically that someone's in pain usually. I mean, you can't see how much pain they're in or what kind of pain, but if you look at the limb specifically, you could see that something's not right with that limb. So with my foot, sometimes it will be bright red. It might be a blotchy, like reddish white, and it'll be swollen. If you were to touch it, you could feel heat radiating from it. It's very bizarre. My RSD resides in my left foot and goes all the way up to just above the knee. I also have osteoarthritis in my left knee, and we'll be talking about that in part 3 of this series. My RSD pain, for the most part, consists of burning and electrocuting pain. However, there's lighter pain that can feel like pins and needles or feel like my foot might be asleep. Sometimes just a breeze blowing on my foot can send excruciating pain. Some other things that the affected limb is prone to are things like thinning of the skin, muscle atrophy, stiffening of the joints, and a weird one is that your hair and nails actually grow faster. So you may have RSD on, say, your left hand, and your nails are going to grow faster on your left hand. So, little interesting fact there. So anyone can get RSD, however, it's more common in women. 90% of the cases, it's caused by some form of physical trauma. I've heard some pretty interesting stories of people getting it from the most random of occurrences. My doctor told me of someone who got it from having an ingrown toenail removed. A good friend of mine I was speaking to the other day, who actually I'm going to be having on the show here very soon, she told me of someone she knows that actually got it from a spider bite, believe it or not. So it could be from just about anything. So be careful out there. I've been diagnosed with RSD by at least 6 different doctors that specialize in the area of RSD. Two of them currently work at Stanford in the pain management department, while one of the two is running the department. Another one used to work at Stanford. He helped create the pain management department back in the day, and he actually trained the former two I just mentioned. So there's no denying what I have, and it's good to know I have some of the best that diagnosed me and are treating me. One of the treatments I received that was probably most significant throughout my battle with RSD was sympathetic nerve block injections. I had 18 of them total. It's where they take really long needles and they insert it into your spine and they inject usually a mix of different drugs directly into the nerve. Each injection never lasted more than a week or two at best, but it was a thing that truly helped me get from the bed to the wheelchair to the crutches to cane. Thankfully nowadays, there are a lot of different treatments out there that are available to us because they don't all work for everyone and not everyone is the same. I know I've had plenty of experimenting with different treatments and medications over the years, and only a small handful of them actually worked. There are three main types of treatment that doctors use when treating RSD, and they like to utilize all three in combination to achieve the best results. One of them is physical therapy or occupational therapy. Another is psychotherapy, because a lot of people with RSD, especially when new to it, will get depressed. You may get PTSD, you may have anxiety problems. So that may sound like a silly one, but it is very important to treat when you have RSD. And the third one is medication. There are many medications out there that can help treat RSD. Some you wouldn't even think of, such as anti-seizure medications or antidepressants. Remember, it is a neurological condition, so a lot of drugs that are meant to treat neurological disorders may help RSD. Alright guys, that's it for today. Thank you for watching. Please stay tuned for the final installment of my story, Part 3, Osteoarthritis. Also coming up soon is our very first guest. She's a good friend of mine and the biggest RSD advocate that I know. So much that she got RSD tattooed on her wrist. Now that's a hardcore advocate. She was really there for me in the beginning when I was first diagnosed with RSD myself. She's going to be coming on to tell her story of when she was diagnosed with RSD at 21 years old, as well as we'll be asking her some questions, and maybe we can get her to show us that tattoo. So make sure to stay tuned for that. Alright, you guys know what time it is. If you like this video, please hit that little thumbs up, please subscribe, and please hit that notification bell if you want to be notified as soon as my next video is uploaded. Thanks again, guys. Peace.